Welcome to my channel once again. Today we are going to look at one of the most commonest nursing diagnoses frequently used in nursing care plans. Right, previously we've discussed the basic of filling the nursing care plan sheet. So for more information, you can try and look out for my previous videos on this particular topic. So this nursing diagnosis falls under the domain 5, perception and cognition, class 4 cognition 00126, and then the diagnosis is deficient knowledge. Right, deficient knowledge, probably known as knowledge deficit. But in NANDA, deficient knowledge is used, but when you use knowledge deficit, it's also considered. So let's look at what knowledge deficit or deficient knowledge is. That is the absence or deficiency of cognitive information related to a specific topic. Right. So what's the characteristics of this nursing diagnosis? So it includes inaccurate follow-through of instruction. So to know that a client is deficient of knowledge on a particular condition, you realize that the patient actually has an inaccurate follow-through of instructions given to that client. Then the patient or client will have inaccurate performance on a test, especially when you assess the client. The patient will not be able to give you right answer or correct answers. Then the patient may have inappropriate behavior. Technically, the patient will not be able to actually provide the answer, so begin to behave in a way in which like you are disturbing that particular individual. And then what shows a patient has deficient knowledge also include insufficient knowledge. At the end of the day, after assessment, you realize that the patient can't demonstrate enough knowledge on that particular topic. Now let's look at some related factors of the nursing diagnosis knowledge deficit or deficient knowledge. Right, so after your assessment, quick assessment on the client, and you realize that the client has little knowledge about his or a medical condition, you will first of all have to assess and know why the client actually has limited knowledge on that particular condition. Right, so some of the related factors are alteration in cognitive function, alteration in memory, insufficient information, then insufficient interest in learning, insufficient knowledge of resources, and then misinformation presented by others. The most common related factors of this diagnosis commonly in our society, Africa as a whole, is mostly insufficient information, insufficient interest in learning, insufficient knowledge of resources, and then misinformation presented by others. Right, so these are the most common related factors that leads to deficient knowledge, mostly in our setting, because our country is more of a developing country and literacy rate is a bit shaken. So it's not everyone who can actually read or understand certain conditions we have around. Technically, they may know something small about the condition, but it's not sufficient, making this particular type of nursing diagnosis very common when writing care plan. Right. Alright, so now let's look at how you use this nursing diagnosis to fill your care plan sheet. Right, so first of all, the cover page, we have the patient demographic and or bio data, and then we have the patient strength and then problem. So most of the time with the cover page, as I projected earlier in the beginning, those information are easily accessed to you. Now your major issue here is how you develop a problem for the patient and a strength for the patient after assessing the client and realize that okay, this client has issue or problem about not having enough knowledge on his or her condition. Right, so now in the patient problem column, simply write patient had less knowledge about his or her condition, or patient slash family had little or less knowledge on condition. Into bracket, you can put the condition over the malaria, hernia, etc. Right? This is your own style. But your main agenda is to make the sentence understandable to the examiner to mark. So patient slash family had little or less knowledge about malaria, or patient slash family had little or less knowledge about condition into bracket malaria. You quickly go down there and try to get a corresponding strength for the problem you discovered upon observation of the client. You realize that the client actually is not practicing the needed protocols for his or her condition. You realize that no, this client doesn't have knowledge about the condition he or she is going through, or after assessing the person with questions, you realize the person can't even provide detailed or correct answers to his or her condition. You develop this problem. Now, getting your strength has to match with the problem. So now you assess the client to see whether the client is now capable of joining you, getting ready to know much about the condition. That will develop your strength. So your strength can just be patient expressed or expressed readiness to know more about his or her condition. That gives you a baseline to be able to help the patient overcome his or her diagnosis at that point in time. So patient being ready enough, meaning patient having full time to understand, okay, my condition is this, how I'll be able to overcome it. Another way of writing the strength is patient is willing to be educated on his or her condition. You write the condition over there. That's why I always leave the curly bracket over there. Another stylish way of writing the patient strength, like sometimes the patient technically knows something small about the condition, and that can be the patient's strength, right? So patient was able to identify some risk factors and symptoms of the condition, so of malaria. That is a strength because it gives you a building block to actually lean on while educating the client, right? So these are some various strengths you can use for the problem above, and then leading to bringing up the nursing diagnosis, which is deficient knowledge or knowledge deficit. Sorry, this is not a bit clear, but you have to cope with me. It's just to guide you understand what we are doing here. So now that you realize your nursing diagnosis is knowledge deficit or deficient knowledge, what are you going to relate it to? We've discussed the related factors below previously. So here, per your analysis and assessment of a client, realize that okay, my patient probably doesn't know a lot about malaria because he or she doesn't have inadequate source of information about the condition. You write knowledge deficit related to inadequate information on what the causes, signs, symptoms, and management of the condition into bracket, maybe malaria, right? There are other factors you can relate it to. We've discussed it previously, so you can refer and then pick several type of related factors if you want to, but mostly this is what we use. Yeah, so that's your nursing diagnosis. You have your mark, then quickly run to your objective stroke outcome criteria, which we have our patient and family will uh, be updated on condition and its outcome within 2 hours of hospitalization as evidenced by. So this can be adjusted per your time at which you can assist the patient and the family grasp some few detail about the condition, right? So this is just a guide. So as evidenced by patient slash relative or family giving feedback on condition and its post care. Yeah, patient slash relative verbalizing they have adequate understanding about hernia and its management. So technically this care plan is actually targeting a condition which is hernia, right? So everything about it should reflect the condition you are actually tackling. Great. So now what are the nursing orders? So first of all, you have to assess the patient level of awareness of hernia or the condition which you are tackling, right? Then two, you allow time for question. You establish rapport with the client and relative to gain trust. Then you educate the patient and relative on the causes, signs, and symptoms management of the condition, which is hernia. Then 5, you educate patients on um, adherence to treatment regimen, right? Then you ask for feedback after education to be sure that actually the patients are really getting something. Great. So now the nursing intervention aspect is probably somehow like the past tense of the nursing orders with some few rationales. But in a critical exam situation, you might be in rush to finish. So sometimes you best just focus on making it past tense and then run scot free than trying to rationalize it, which might take away your time. So with the nursing intervention, we have patient's level of awareness about the condition was assessed more like a past tense through question. Then clients and then relatives were allowed to ask questions and they were answered tactfully to aid understanding. Then a good interpersonal relationship was established with client and relative to provide a good atmosphere for learning. We have client and relative were educated on the possible causes, signs, and symptoms and management of hernia. Great. Then the fifth one relating to the order is patient was educated on the need to adhere to treatment. Good. Then the last one is client and relative were made to repeat what they have learned from the education that were given and were given praise for their efforts. Very simple. So with your date and time as well as you begin, put it over there. Then if your goal is fully met, right? Goal fully met as evidenced by what? Patient relative gave feedback on condition its post care, and then patient and relative verbalize they have adequate understanding about the condition, which is senior, and its management. Very simple. Very simple, right? So this is one of the most commonest nursing diagnoses being used frequently because of our setting, looking at the way most of our clients handle their condition. Mostly likely that majority of them doesn't even know the full cause of the condition itself. That's why they keep coming with the same condition, malaria. Probably they don't even know the purpose or the reason why they are using the mosquito net, or don't know the reason why they are not supposed to stay outside for a long time wearing short clothing while allowing mosquitoes to invade. All right, thank you for your time. God bless you. Don't forget to like, share, and subscribe. Tomorrow or any other time, we'll look at any other conditions related nursing diagnosis that is commonly used. Bye bye.